Good afternoon, everyone, and welcome to today's webinar hosted by Patagonia Health. Today's webinar topic was actually requested by an attendee, which is fun. It is called Change in Healthcare Strategies to Engage and Empower Staff. If you aren't familiar with the Zoom webinar platform, take a look at the control panel at the bottom of your screen. Here is where you can configure your audio settings, send chat messages, and ask questions, and we will have a Q&A at the end. To make sure that chat button is working, go ahead to that area and type in what the weather is like where you are joining us from today. I wrote my script this morning and I had it written out. It was gray, but not freezing, so I was happy. But right now in North Carolina, it is really gorgeous and sunny. Good to hear that there are some good weathers going out there as well. That's awesome. We are so excited to hear from our own Patagonia Health experts today, Brittany Chanel and Jennifer Hassa. As a quick background about them, Brittany holds an HIT and HIM degree along with her PMP certification. She started her career in Michigan Public Health almost 15 years ago before transitioning to the software side in 2017, where she led implementations as the senior project manager at Patagonia Health. But now she works as an implementation and training specialist here. Her public health background helps her connect with customers. Then Jennifer Hassa is an experienced instructional designer and learning and development professional with a strong focus on creating engaging educational programs and training solutions for diverse learners. She specializes in leveraging learning management systems and instructional design strategies to enhance knowledge retention, compliance, and professional growth across healthcare and educational settings. So without further ado, I'm going to pass this over to Brittany and Jen. And Brittany, you are still on mute.
It's not a webinar without that happening. Good afternoon or morning, depending on what side of the United States you're sitting on now. I would like to remind you all to use that chat down below to ask any questions throughout this time if you would like. I'm going to start out by covering some fundamentals of change management in healthcare and also some examples of things that either I've done myself that have worked or that we have seen our implementations do. So one of the first things that I'm going to talk about, and it's going to be cliche, just like everything else, it's going to be communication. So one of the biggest things in any kind of change is communication. Often, early, clearly. I read recently a quote that said, the single biggest problem with communication is the illusion that it has taken place. So oftentimes we feel like we have communicated things from management or leadership or even from vendor sides versus customer sides, and maybe the communication wasn't clear, wasn't concise. So making sure that you're always communicating often and clearly with your team is going to be a huge part of your change management. The what and why. So you go back to that school time when it was like you're telling a story and who, what, when, where, why, all of that. Your what and why are going to be a big thing. If you don't take the time to communicate how these changes are going to be positive, if you don't take the time to make sure that your staff is aware of the changes that are coming and things like that, you're going to lose confidence in your change that you're trying to make, whether it's an implementation of a new system or a change in just a process. It can be anything benign as changing the signs in your lobby to implementing a brand new system in your entire facility. Communication is going to be key. That's what's going to build your trust. That's what's going to build your foundation going forward. We've seen so many amazing things happen for communication. We have seen just regular emails that go out to staff in like a fun newsletter style format. We have seen town hall meetings. Those were really neat. I've got to sit into a couple of those at different customer sites where monthly they'll hold a town hall where they will give updates on whatever is going on in the entire health department or in the county, even depending on what level you guys are at for your communications and things like that. Having regular meetings with your vendor, if you are implementing something that has outside vendors involved in it, engaging with your staff throughout the entire process. A huge thing is to be transparent. The last thing that anybody wants is to find out about a change when it's happening. And we have showed up on my side as far as like training goes. We've showed up and there have been staff that have said, I just learned about this last week when I was told to show up to training this week. And that's usually leads to poor adoption, leads to people not wanting to do the change because they don't feel like they were involved in it. Modeling the desired behavior for your team is also going to be a big thing. If you are framing things as the benefits and things like that, but also being transparent that it's going to be messy to implement a new system or to make a big change in a process. One of my favorite analogies to use is you're remodeling your kitchen and you have tarps everywhere and there are workers and there's dust and you're eating breakfast with your kids at the coffee table in the living room and it's all just bothersome. It's change can be bothersome. But you know that when you get on the other side of that change, you're going to have this beautiful kitchen that you're going to create these memories with your kids in, or create memories with your family in, or maybe even your dog, whatever you prefer to create memories in, things like that. The next thing that I'm going to go into is communication being expressed through actions and influence. And so when you are standing in front of your team and your body language and facial expressions are different than what you're saying, that's going to be noticed. Things are not only verbal. Communication is not just verbal. So, making sure that you are not sitting there saying, this flight to Hawaii is going to be amazing while you're gripping the chair in the plane and you're grimacing on your face, and everybody's going, oh my gosh, should I be worried? Things like that. I've witnessed both sides of leadership on this. I've witnessed leadership that is they're not as on board with the changes that are coming up as they should be. And so that shows people will see that. They will view that, they will hear it, they will see it, all of that in everything that you do. Another thing, since we are an EHR company and we work with public health departments and public health is my background and my niche area, one of the some of the best implementations I've seen have people involved all the way up to the commissioner of public health. Those usually have the best adoption. When you've got positivity coming from higher up to even in the organization, that's always a good thing. It's always makes people feel a little more comfortable and they think, okay, if these people are involved, this is an important change that we should do. And then you can move to the next slide, Dina. All right, engaging. One of the quickest ways I've seen staff morale and engagement be just snuffed right out is to not involve all levels of stakeholders in your organization, all the way down to the people that do the job day to day to management. Having only executive level leadership sitting on your change board doesn't work out well. You have to involve the people that do the job day to day. You might be the manager of the area that you're in and you may know a lot about it and you may have been doing it 30 years. But if you're not doing the job day to day, there are things that you may not think of while you're reviewing these processes, while you're talking about what changes could come, things like that. Huge plus to any customers that have done this. Their implementations have automatically gone a little bit better than others. With implementations of software or any kind of change processes, involve those SMEs, those subject matter experts, form groups. With us being in the EHR space, do you have a clerical work group? Do you have a billing work group? Do you have a work group with your nurses? And then do you need to split the work group out into the nurses that do immunizations and maybe the nurses that do reproductive health, things like that? Having those. You also have to actively listen and address concerns. Just because you don't address the concern doesn't mean it goes away. And a lot of the times, people just want their concerns heard. A lot of the times, just listening to them voice their concerns is enough to alleviate their concerns. Honestly, sometimes people just want to be listened to. And this is going to be an unpopular opinion. You're probably not going to what I'm about to say, but you have to actively seek out those concerns. And I'm sure because of what I just said before, you're saying, why would I actively seek out negativity when you're telling me that we should form this as positive and benefits and things like that? Because you can still actively address concerns and seek them out and it not be negative. despite what people think, conflict is not always negative. Conflict can be a positive thing. And if you're turning conflict into something positive, it'll help. It'll go a long way. Okay. A lot of the times, giving just that attention to them, that you hear them, that you understand that they're worried that they won't be able to register people as quickly as they used to, things like that, is going to go a long way. So, what are some ways that you can actively listen and address concerns? This can be done a few different ways. I have seen people actually sit in a room and just, hey, what are you guys worried about? And then I've seen people send out surveys that are anonymous, that it's just put your worries, and then they have a agency-wide meeting or a town hall, virtually, in person, however you guys do it, and address those. Here's the top things that we've seen as issues. Here are the top things that people are concerned about. Here are the things that we want to address, and being able to address those. Okay. Embrace the discomfort that comes with change, because change, no matter if you pride yourself on being very change positive and not change adverse and things like that, change is still uncomfortable. I am a chameleon. I can fit myself into just about anything and be okay with it. But change is still uncomfortable. You still have to embrace that discomfort. The human brain is not wired for change, it's wired to resist change. Okay. It's going to be big, it's going to be messy, and at times it's an unclear beast. There are going to be times when you have to just embrace that you might not know what's exactly going to happen with this part, but you plan to go forward and get that going. If you are relaxed and comfortable, when you fall, you break less bones. So if you're pulling in the comfort, you're making sure that you're talking with your staff and communicating and engaging, and all of that's going to help with these changes. You can go to the next slide. Empathy and flexibility. So I don't know how many of you are familiar with the buzz term that goes around now, emotional intelligence. And I have gotten a lot of feedback. Emotional intelligence is one of my favorite psychology study areas and change management study areas. Emotional intelligence versus not having the emotional intelligence versus what is the right level of emotional intelligence, how much is too much, how much is too little, all of that tends to weigh to a lot of opinions. And I've talked to a lot of people about emotional intelligence, and I've gotten views on all the way up to people who are like me and they just geek out on that topic, and people who are like, emotional intelligence, there's no place for that in the workplace. And what it all boils down to is people look at emotional intelligence like it's this buzzword, but it's really just it's being empathetic to what your staff is going to go through. If you're changing the way that someone is doing their day-to-day job, that's going to cause some fear, some concerns like we've talked about. Okay. The human brain, like I said a little bit ago, it's not wired for change. It is hardwired to resist change. When change happens, habitual patterns are interrupted. So if somebody has habitually done things a certain way for years, even a year, even 6 months, they have to rewire their brain to make these changes that are going to happen. Even though at the end of the day, implementing a system such as our EHR and things, we're not changing what you're doing. You're still doing your same exact things. You're still sitting at the front desk and you're getting name and insurance and address. And how would you like to be reminded for this appointment? Oh, here, sign this HIPAA form. In the back, you're still coming in, you're still taking vitals, you're still asking questions, you're still saying, are you sick today? Do you have an egg allergy? Do you have a latex allergy? Things like that. You're still giving VIS sheets. You're still doing all of that. It's just in a different format. And when you wire your brain to think that, hey, I'm still doing what I've always done, I know how to do these things, this has been my job, putting in the new process becomes a little bit easier, because at the end of the day, you can run that mental checklist of, did I do all the things that I need to do? And then eventually it becomes second nature. You're just like, hey, I'm documenting this way now, and I don't remember what I did before. Paper charts, what are those? That kind of thing. One of my favorite things to talk about and use in addressing like fears and concerns and openness to change is, a lot of the times I get the comment, I'm too old to learn a new system. That's subjective if you think you're too old to learn a new system. But I asked them to pull their phone out. What do you think they pull out most of the time? I have had flip phones pulled out a couple of times. Not going to say I haven't, but most of the time they pull out a smartphone. They pull this out. Okay. They pull out a smartphone, whether it's Android, iPhone, whatever else might be out there. They pull this out, and I'm like, what do you do on that phone? I call my kids or my grandkids or my friends. I text them. I get on Facebook. I tend my farm. I play Tetris, whatever it might be. At one point in time, did you hold that phone in your hand and go, I don't know how to work this thing? It is definitely not the wall on the phone where my little brother would listen to my conversations with my friends. It's a little bit different, but people learn it. I've seen people of all ages figure out how to post things on Facebook, how to call somebody, how to text, how to email from their phone, all of that. And usually, once you bring that up and you start doing the smartphone talk with them, it changes a little. Then they get a little more open to the fact that, yeah, at one point I didn't know how to use this and now I do, things like that. Another thing that is very helpful is to frame things in a reward sense. So, when you as leadership are getting ready to announce this change, you're getting ready to implement a new HR system, a new environmental health system, a new anything, even up to a new phone system, maybe even. One of the things that I always recommend is sit down as leadership and ask yourself, what problems are we solving with this change? If you're not solving any problems with the change, why are you doing the change? If you're required to, then why are we required to do this change? That kind of thing. But I want to back up because most of the time you're going to have reasons for why you're doing this change. It'll streamline processes, it'll make check in quicker, it'll show that I'll get better appointment stats. I'll get better stats on how many appointments we're doing and how many people are actually showing up for appointments, things like that. What education are we giving people? Oh, a lot of people are asking about smoking cessation. Hey, I have enough numbers here that maybe I'll get a grant for smoking cessation, things like that. We all know that a lot of things are grant funded in the world that we live in, and even behavioral health. You might be able to figure out things that you could bring into behavioral health. Hey, a lot of people are asking about peer counseling. We should look into a peer counseling section, things like that, to add some humor to it. One of the things that is a big benefit to individuals when I am out training, or even when I spent the 7 years prior implementing systems, I've already seen a lot of names on here of people that I've implemented or that I even worked with when I was in Michigan Public Health. One of the great features is nursing no longer has to go up to the front and say, hey, what's the status on that patient? What's the status on that patient? Because they can see the appointment statuses in today's appointments. They can see that person they've arrived. Okay, now they've been checked in. That means I can go get them. Oh, hey, I'm putting them in room 1, or I'm putting them as with the nurse. Then the nurse practitioner knows, hey, it's my turn to go see this patient for their annual exam. Things like that. These are all things that you're solving. So asking yourself that simple question with any kind of change management, what problems am I solving, is going to give you your base for how to word it. It's going to give you your base. The other thing that you've got to be very vigilant about, and I'm going to somewhat contradict some of what I'm going to say in the next slide, but I'll tie it all together. One thing to keep in mind is, if you're familiar with Murphy's Law, anything that can go wrong will go wrong. Flexibility is key. Okay. That does not mean that your whole project's going to go wrong, your implementation, your change process, your phone system, whatever. It just means that if you're prepared, less things are going to go wrong. And then when you are prepared for things to go wrong, you're going to be able to respond to them. Flexibility is key. I tried to channel Stretch Armstrong, and this was the picture that it gave me, but flexibility is key. Twists, turns, changes, all of that key. Murphy's Law, anything that can go wrong will go wrong, is a great thing to keep in mind. You can go ahead and go to the next slide. Okay. With that being said, we've discussed communication, influence, engagement, empathy, and flexibility. In order to accomplish these, you have to plan and stay focused. While you have to be flexible about obstacles and things that can happen, the most successful projects I've managed have had strict timelines. They've built in that flexibility that you need, but they have deadlines set up. They have roles defined. They have responsibilities detailed out. They have milestones listed. Laying out a clear roadmap is going to be one of the keys. So while you've got to remain flexible and you got to build a little bit of that flexibility in there, having that roadmap, that timeline is going to be crucial. And defining what your critical path is. No matter what you're implementing, whether it's just a change in a process or things like that, there's always a critical path. And critical paths are those steps that have to happen in order. Once you know what steps have to happen in order, you can break them down into manageable chunks. And then you also know what can shift and what can't. Okay. You know that before you plant your garden, you have to till the soil and you have to weed out anything that might be there. And maybe you even have to enrich the soil with nutrients before you can plant anything. Okay. If you don't do those things, planting's not going to be very successful. Okay. Breaking things down into steps is key. Breaking things down into manageable chunks is key. The other thing that is going to help drastically, don't try to change too much at once. Trying to change too much at once will overwhelm. Less adoption happens when you try to change too much at once. If you are implementing a electronic health record in your clinic, you shouldn't also be implementing a new lab software at the same time. Okay? Stage it out. Don't overwhelm. If you're changing every workflow process, don't also go through and change 5 other things at the same time. Give people time to adjust. Okay. If you're implementing your whole EHR, that's a great time to make sure that your workflows work well. But it is not a great time to decide to remodel your entire health department at the same time you're implementing the software. Okay. That's too much change. Even if that renovation has nothing to do with the implementation of that EHR, staff trying to wrap their brain around implementing an EHR and then also having construction crews over here making noises, moving things around. Obviously, things happen that you can't predict or stop, but implementing too many things at once will overwhelm staff. Okay. So, what are some ways to not overwhelm staff when you do need to implement a whole new system of some sort? Cheat sheets. Cheat sheets are wonderful. They work amazing. If you know that this type of visit needs to have these codes listed on the encounter in order for billing's job to go make cheat sheets for your clerical staff or your clinical staff. If you know that these are the payer codes for your insurances that you use, make a cheat sheet for the clerical. Make process sheets. Simple things. Yes, we have full out guides. Patagonia Health has a vast majority of resources for our customers. But at the end of the day, what's something quick that your staff can look at? I've implemented a couple different EHRs in public health. And one of the things that I've done both times, and that was just on the customer side of it, I have done hundreds of implementations on the vendor side. One of the things I did on the customer side is I made about 5x7, maybe even 4x6 size cheat sheets that we laminated, punched a hole in the top, put a ring in it, and everybody had one. It had payer codes, it had the type of flags that you're going to use, it had what the process would be if somebody came in and didn't get services or something like that. They're going to go a long way. So, communicating with staff, listening to them, making things easier where you can. That's just something you can do that's going to help adopt change. Okay. That's all going to help. The other thing that you don't want to do is say your implementation's 9 months long. Don't save everything for month 6. Make sure you've planned things out where the things you can get done earlier in the implementation of your change, your system, whatever it may be, the things that you can get done earlier that aren't going to change, do earlier. The things that you know you have to do right before go live, inventory, for example, if you want to relate it back to Patagonia Health, you don't want to put your inventory numbers in 2 months before you're going to go live, or a month before you're going to go live, or right after training. You want to put your inventory numbers in the day before go live. There are some things that have to happen close up, but if you save everything for the end, then everything feels overwhelmed. You feel like you've got too much to do, things like that. So one of the best things that we've seen work is these work groups, but also making sure that you meet about the configurations. Even if you can't start the things that you want to do, if you know that you have a list of 40 visit types because of maybe the way you used to have to classify things, or maybe the system you were in or things, and you know that now you can break that down. You don't need a check-in status for each of your 5 programs. That's just one appointment or one check-in type now, one status. Or maybe annual visit for both reproductive health and family planning. You don't need it for both. You just need one annual visit type, things like that. Starting that kind of stuff early on is going to help. And then to keep momentum moving, meet with your vendor. Make sure you're on track for what you're supposed to do. If you're working with a vendor that's experienced in change management, they're going to be able to help you. They're going to be able to tell you, hey, yeah, nope, you're doing okay right now. You've gotten everything to me that you need to. Your next step occurs on March 15th. You'll meet with the trainer, things like that. Or, hey, no, actually, you really should have been doing these things. Like, how about we get started on this now? So rely on your vendor some for that too. Okay. And then, like I said, don't procrastinate. Don't save it for the end. Make sure you've made work groups based off of the SMEs, the people that do the day-to-day job daily, the people who are actually the ones who will be able to tell you, yes, this is a process we use currently, and then, well, no, it won't work if we change it to that way because of this or that, because the state requires us to say this, or FPAR requires us to say that, things like that. Those are big. Those are huge. And then go ahead and go to the next slide. All right. And then you're going to celebrate. Big, small, celebrate. Okay. This is probably one of my favorite ones to talk about because I have so many examples of things that I've watched customers do that have been great. Okay. So I have virtually dialed into a pep rally. Like they were going live on Tuesday and they had a pep rally Friday at the end of the day. It was like back in high school. People were just like having fun and they had music going and they had a pep rally and they were like celebrating the fact that they had made it this far. They had gotten through the implementation parts, like the early implementation parts and the training, and now they were going live, things like that. I've been to places that have been decorated up for the go live. I have been to luau themed go lives. I have been to what else? We've been to, I didn't get to go, but some of our staff went to another go live that was in the same state and it was all Harry Potter themed. I have seen them do Western theme, cowboy boots and all of that. So much fun things. Another thing that we've seen people do, we had a state where for each of their districts that implemented, there was a special souvenir for each district. So it was like a collect them all, like a Pokemon card kind of thing. And it was just like this fun little, if you helped implement that district, like here's your little badge token that you got. And it was fun. I've seen people have little friendly contests, like who saw a month in when schedules went back up, who had the least error rates at the sites. And of course, some of these are bigger ones. I recognize I've been to go lives where it's 2 people, and I've been to go lives where it's hundreds of people that are users in the system. All of those kind of things are great. The biggest thing is celebrating the wins because there are going to be times when it's going to be stressful. Change is stressful. There's going to be times when you're going to go, oh my gosh, what do we get ourselves into? I can tell you from personal experience, both on both sides, that time does eventually end. That time does eventually, you look back and you go, oh, wait, what did we do before? Oh, how did I ever build these things manual? I, my specialty area is clerical and billing as far as like training goes. And so I know there are billers out there who have told me that they don't want to go back to printing off CMS 1500s on that colored sheets ever again. And it's great when you get to hear that kind of stuff. One of my favorite things that I like to celebrate in training itself when I'm up in front of people is when I train and I have somebody go, "Oh, this is gonna be so much easier." And I'm just like, "Yes." And then I always bring attention to it. I'm like, "See, guys, there's light on the other end." If you have neighboring people that have counties, agencies, depending on if you're in public health, behavioral health, where you're at, if you have neighbors that have done these things, ask them what ways they celebrated. Maybe they've got some great ideas. Maybe they'll know ways that you can avoid hurdles too. So community never hurts when it comes to changes. I'm still a firm believer of it takes a village. All right. I think that's all of my slides, but are there any questions for my portions, Dana, before we let Jennifer go?
I think we are good on questions, but if you guys do have any questions for Brittany about her presentation, go ahead and drop them in the chat or in the Q&A, and I can get to them at the end. So you have a minute to think about them too. Jen, are you ready for your portion?
Yep, I
All
am.
right.
Thank you both very much. So, good afternoon, everyone, and welcome. I am going to talk about engaging and empowering staff through learning. So, we all know that change is constant in healthcare. New regulations, evolving technology, and updated workflows are part of our daily reality. But change doesn't succeed just because we implement a new system or policy. It succeeds because the people using those systems and processes are engaged, informed, and confident. Okay, go to the next slide. Healthcare staff face enormous pressure. We all know this when change is introduced. Like Brittany was saying, there's often limited time to learn something new. And when workflows shift, it can create confusion or errors. This isn't about staff unwillingness, it's about not having the right support. For change to succeed, employees need clarity, confidence, and guidance. And then that's where learning comes in. You can go to the next one, Dana, please. Learning doesn't just teach staff how to do something, it explains why it matters. So like Brittany was saying earlier, when people understand both the what and the why of a change, uncertainty is reduced, trust is built, and adoption is far more likely. Structured learning also ensures that these behaviors stick so staff continue to apply new processes correctly. Okay. So I'd like to take a quick poll, if that's okay, if you have a second. When a new process or system change is introduced to you, what helps you feel more confident? Dana put up a poll here for you to just take a second, choose the one that fits best for you, that resonates most. We have short task focused trainings, on-demand videos and guides, live or recorded webinars, or just winging it. So go ahead, take 2 seconds, pick which one resonates most, and then we'll just take a look at the results in a second. Okay. So I think that's enough time. Dina, are there enough people? Okay, perfect. So typically, people prefer options that are practical and accessible, short-term trainings, on-demand guides, or webinar. So this feedback does align perfectly with the tools that we are discussing today. You can go ahead and take that off, Tina. Thank you for participating in that. So staff engagement rises when learning fits naturally into their work. You can go ahead and go to the next slide. Okay, long, generic sessions are often skipped or forgotten. We all know long and generic sessions tend to get a little boring. Engagement is highest when training is directly relevant to daily tasks, easy to access, and practical in its application. Thank you. Webinars are a powerful tool for communicating change. They are live sessions given by staff, and they give staff a chance to see new processes in action, ask questions, connect with the leaders giving them. Recorded sessions ensure that anyone who couldn't attend can still access that training on demand. So, this combination ensures that everyone receives the same information, which is key. We want everyone having the same knowledge about different changes we make. And this helps reduce mistakes and confusion. Microlearnings are another option. So microlearning delivers short, focused modules on specific tasks or updates. So they're easy to complete between shifts or during short breaks for staff, making it much more likely that they will absorb and then apply the content immediately. So microlearnings respect both the staff time and their attention. So they're a good one to use for staff on the go a lot. Okay, go to the next. Gamification is another great example. So gamification uses small rewards, and I think Brittany was talking about this as well. Badges or progress indicators to motivate learning. It doesn't have to be about competition, even though I have found out a lot of people like the competition, but it is about recognition and encouragement. Staff see their progress, they feel acknowledged for their efforts, and then are more likely to complete that training. This simple tool dramatically increases engagement. All of these tools can be utilized in an LMS. The LMS serves as a central hub for all learning. It organizes training by role or department, tracks completion, and then ensures staff always have access to the right information. This consistency reduces confusion and allows leaders to monitor progress. Okay, you can go. This one. So, this just in time learning means that staff can access resources exactly when they need them. So, whether it's a quick guide, a short video, a searchable on demand resource, this reduces errors, improves workflow, and gives employees the confidence to handle tasks without delay. Benefits for organizations: investing in learning leads to faster adoption of new processes. So, fewer errors, improved efficiency, and stronger compliance. A well trained workforce is a more resilient workforce. So, benefits for staff is staff learning builds confidence. It reduces the stress on the staff. Flexible access, on demand resources, and clear instructions show that the organization supports them. This, in turn, improves engagement and builds morale, which is very important. So, some key takeaways from today are: change is inevitable, but disengagement doesn't have to be. Learning delivered through an LMS empowers staff and ensures change is successful. Multiple tools like microlearnings, webinars, gamification, and quick guides, they meet different learning needs and keep everyone engaged. People do learn differently and they like to use different tools when they're learning that information. So it helps provide. So, to close, confident and engaged staff are essential for successful change. Learning and an LMS provide the structure, tools, and support to achieve that confidence. By investing in staff learning, we improve patient care, operational efficiency, and long-term organizational success, which is what we all want. So thank you. That wraps up my time, and I appreciate you joining me, and I will turn it back over to Dana.
Great. Thank you so much, Brittany and Jen. If anybody has any questions, feel free to put it in the chat. I will say I will be sending out a recording of this webinar and the slides to the email that you provided at registration. So if there's anyone you know that wasn't here today that may have missed it, no worries. I will be sending that out so you can forward it to whoever. There also is, when we end today, there's going to be a survey that pops up. That's where you provide feedback for ideas for future webinars. So if you were sitting here being like, what would be awesome webinar? X, Y, and Z. So put that in that survey at the end. And if this is your first time hearing about us at Patagonia Health, let me introduce us. Welcome. We are an integrated EHR practice management and billing solution designed specifically for public health and behavioral health. We have lots of in-depth training, but we also offer a learning management system like Jen was talking about. So that's really exciting. If you want to learn more about us, you can visit our website at www.patagoniahealth.com. Have a great day, everyone. Bye.
Thank you all so much.